And I think that's very crucial. And the difficult fact that's out there that not any candidate or political party can change is that Medicare healthcare costs to the government drive the federal deficit. It's not roads and bridges, it's not defense, but Alan Blinder, who's an economist with the Federal Reserve and up in Princeton, pointed that out in the Wall Street Journal in January. So that is a key part of the discussion. There, as a physician, there are low-hanging fruits that we can address in that. Like dialysis is taken care of through Medicare. So we have patients who miss their dialysis. They come in the emergency room because they need to get emergent dialysis. They get the dialysis, and actually they still have to be admitted to the hospital, even though it was perhaps done through the emergency room, because for the facility to be paid, they have to be inpatient stay, even though everything is done. Nothing happens upstairs. Patients who are to go to nursing homes, like the day after Thanksgiving, family members realize, mom or dad or grandma or grandpa can no longer take care of themselves and need to be in a nursing home facility at that point. Those are mandatory 3-day hospitalizations in order for the nursing home care to be cared for by Medicare. Nothing happens in the hospital. Nevertheless, they're in an inpatient bed upstairs. There's also situations like, long-term care patients have. So someone is living independently that's elderly, and they're usually paying for that out of their pocket. Once they run out of money, even though that they're living in an independent living, assisted living facility, they're required by Medicare and Medicaid then to go to a skilled nursing facility, which about doubles the cost, up to about $70,000. Even though their physical needs don't change, if they run out of money, suddenly they have to be in a long-term care facility. So that doesn't make sense. There's also duplication of care, lack of transparency in terms of those EOB's, explanation of benefits. If you ever have a family member, you try to sort out what are these. It's a nightmare. So I think there needs to be free market that reintroduces in that. We have to make transparency, and there's some of these things where it doesn't make sense how the program is implemented.